All right. Can everybody hear me?
Yes.
Yep. All right. Welcome. My name is Dr. Steve Tulius. Did any of you hear me last year speak? Okay, great. Some of it will be very similar information, a couple more cases that we've had in the last year. So how many of you have ever been to a chiropractor before? All right, great. Great percentage. How many of you before coming here knew that chiropractic can help people with seizures? Okay, great. So let's dive into this topic. Just this disclaimer here: this presentation is for general information. It's not medical advice. So if you do have questions, please come to me personally afterwards. I will be around to answer any and all questions personally after the presentation as well. A little bit more about me. I've been in practice for 17 years. It feels like yesterday. I absolutely love practice. I love taking care of people. And I used to be deathly afraid of public speaking. Yeah, it may not seem like it now, but man, I used to shake. Anyone share that fear? Right? I used to shake in high school. I was this big lineman. I weighed 60 pounds more than I do now. But it wasn't until I heard a speaker say one time at a chiropractic conference that you can be imperfect and share a perfect message. And that's what I needed to hear, because I was a perfectionist by nature, and obviously I will never be perfect. And so the message I'm going to share today has tremendous value for humanity, not just those here in this audience. And this is my life's purpose, and this is the reason I was born, I believe, to be on this planet, is to share this message with the public. Not specifically just around epilepsy, but in general, because it has so much value for the world. And so I spend a lot of time traveling. I speak internationally. I'm the former Autism One director of the Pediatric Chiropractic Program, and former vice president of the International Federation of Chiropractors and Organizations. And the reason chiropractic really sees the results that we see is this, because we start from a different paradigm. We start with this really crazy belief system that you're designed to be healthy and not sick. Anyone share that belief that we're actually designed to be healthy? All right, okay, so this is one of the many reasons that chiropractors have been labeled quacks over the years. Anyone ever hear that one? All right? I've heard it a few times. And so it's because we have this different belief. We have this belief that we're actually designed to be healthy and not sick, and so we're never looking to treat disease. When people come to me, I don't diagnose anything. People come to me with all sorts of diagnoses from all over the world, but I'm never looking to diagnose anything. I'm looking to find what's interfering with what should be already there, which is abundant health, happiness, quality of life. Does that make sense? And so I'm always looking for interference. So today's lecture is going to be not based upon my opinion. When it is, I'll let you know. It's based upon lots of peer-reviewed reference articles, journals, books, other experts in the field, so it's not just my opinion that I'm sharing here. I don't think this video you're going to be able to hear. I'll start it. If it doesn't play loud enough, then I'll stop it, okay? Can everybody hear that?
First, I'm Dr. Steve at Epilepsy Foundation meeting. My 3-year-old son has epilepsy, and we were looking for some alternative treatments. And we loved what Dr. Steve had to say. He gave a really good presentation, and we came to visit him here at the office. It was just awesome. It was such an answer to prayer, and he is so good with the boys. I have 3 little boys, and every one of them just adores to come here, and they're really sad if they ever have to miss Dr. Steve. And we have seen so many changes in Liam since he's been coming. He went from having up to 60 seizures a day till the last less than a half, almost 2 months. He has been basically seizure-free. So we are definitely proponents of chiropractic and Dr. Steve.
Did everybody hear that?
Yes, sir.
So I start with Liam's story because I know that when I speak, this is actually a very friendly group, but when I speak in front of lots of groups, they have these negative beliefs about chiropractic, or they think chiropractic is about pain, right? Back pain, neck pain, all these things. And so I share this to open up the awareness and to encourage people to open their minds to the possibilities of what it actually is. Liam, and I'll share more of his case in a little bit, but Liam had intractable epilepsy. He was having drop seizures. He was having convulsive type seizures. Medications weren't working. And within 4 weeks, he was seizure-free. That video was taken 6 years ago. He's still seizure-free. And his EEGs and MRIs look completely normal when they were told that it never would be. And so, and the only thing that we changed, the only thing that they did differently is we adjusted his upper neck. Okay, something so simple, right? We addressed a misalignment in his upper neck, and that was the result. So today we're going to talk a whole lot about some of the clinical cases, and we're going to talk especially about the vagus nerve. I know there's I'm sure you all have heard about the vagus nerve right now in the epilepsy community. This is one of the big reasons chiropractic makes such a big impact, because where does the vagus nerve travel? Through your neck, right? So does it make sense that there might be, if there's stress or misalignment of the neck, that might affect your vagus nerve? Yeah. We're going to talk about dysautonomia, heart rate variability. Thank you. And also some other mechanisms of action that could potentially affecting the seizures. So I found this on the Epilepsy Foundation website, and they say the human brain is the source of human epilepsy. And in my paradigm, the paradigm that I started with earlier, I was sharing with you, that doesn't make sense to me. Okay, I look at it from another perspective. I look at it from a different perspective, that perhaps the brain isn't the problem, which is like blasphemy at an epilepsy conference, right? Perhaps the brain isn't the problem. When we're born, is our nervous system fully developed? No. What does it require to develop into higher levels of learning, development, behavior? What does it need? It needs input, right? It needs sensory input. It craves it. In fact, when a child comes out, they start, their hands, their movements, their primitive reflexes are all designed to feed their brain sensory input through eyes, ears, touch, taste, everything. Everything starts to go in the mouth, right? And then movement of the body. Movement is critical for brain development. And so many times there's stages that are missed. If we look at many children's, especially in pediatric epilepsy, if there isn't a trauma of some sort, we'll see that many stages of movement development are missed, like crawling, sitting up, all sorts of different stages of normal brain development are missed. And so we need to start looking at it from a functional perspective, is perhaps the brain isn't the problem, perhaps the brain just isn't getting the right information and can't respond appropriately. So we all have these, we're familiar with these in our homes, right? If there's a fuse blown, we should go check out the fuse, right? And so our brain is dependent upon proper information from our body to actually work properly. But rarely is the connection between that information from the body and brain ever looked at. And I look at seizures actually as the brain trying to reboot itself. See, the brain can no longer handle all the sensory information that it's trying to deal with, all this amazing information it's trying to process, and so it short circuits. It's trying to reboot, reset. So here's some case series. I just added a few more. These are 22 cases presented to my office with seizures. And you can see on the left here, 7 of those cases resolved. That was 32% of those cases, meaning that the seizures went away completely. 10 of those had a significant improvement, 50 to 75% reduction. 4 had slight improvement, 10 to 25%, and only 1 had no change. Right? I would really like to do some more research on this topic. So if anyone has an extra $1 million, let me know, and we'll put some research, because I think this is something that we should absolutely look deeper into. So if you see, 77% of those had significant improvement or complete resolution, and this resolution was seen not in a particular type of seizure. It was seen with grand mal seizures, partial complex, atonic, and even absent seizures. There was significant improvement in genetic cases. A lot of times people ask me, well, what if the child has a genetic situation? I think of it this way. Every single human being needs to have a healthy nervous system, regardless of whether it's a genetic situation or not. If that nervous system is more stressed, and it is going to be in many of these genetic situations, then we want to optimize that nervous system function. We want to get it at a very high level. So it's not going to correct the genetic situation, but it can reduce the threshold or increase the threshold for seizure activity, meaning that the child's not going to have as many seizures if we can improve nervous system function. Does that make sense? And so that's what we've seen with many different types of genetic cases. In terms of time frame, people always ask me this question. In those cases with resolutions, 2 cases were seen at 3 weeks, 1 case at 4 weeks, 1 case at 6 weeks, 1 at 8 weeks, and 1 at 12 weeks, and 1 at 32 weeks with an average of 10 weeks. And really the 32-weeker was an outlier that throws that kind of off too. So this is Liam, the child whose the mom was speaking earlier in that video. He started having seizures at 9 months. He was 3.5 years old when he presented to my office, up to 60 seizures a day. The seizures started to go down slowly when he first started care. At 4 weeks, he was seizure-free. He left for 1 week to go to Atlanta to visit family, had 1 seizure, came back, got back under care. After his first adjustment, no more seizures, and as I mentioned, he's been 6 years seizure-free. These are some of the studies that we do in the office. We do different types of functional studies. This is a paraspinal thermography scan. Chiropractors have been using this since the 1930s, I believe. The skin temperature should be the same within 0.5 degrees from within a short area of skin, excuse me. So we take a measurement, it's about 1 inch apart, and then we measure both sides of the neck. As you can see from this on the left here, so red is not good. White, wherever you see a bar means it was warmer on that side of the spine. So what we want to see is this nice back and forth white with a couple green bars. The temperature should be variable. That we shouldn't see one-sided patterns like that. That's a nervous system in a state of stress. A nervous system that can't regulate something as simple as its own skin temperature. Does that make sense? And so we're able to look at this and analyze it, and we can see then 5 months later, even though he's having no more seizures, his scan still does not look great yet. It's looking much better. We see a lot more green and blues. So the symptoms are gone. However, the neurological pattern is still present. That means that he absolutely still needed to be under corrective care to make sure we cleared the pattern that was still present. And then we saw 2 years later, we saw this pattern doing much better. And on the far left, that's a heart rate variability scan, which I'll talk about. Have you guys heard of heart rate variability? Anyone heard of that? We're going to talk a lot about that in a second here. This is Balam. He was 5 years old. His family came from Africa for the best care possible. They didn't realize it was going to be chiropractic care that he needed. They came into my office. Seizures started several years prior, 15 to 20 grand mal and absent seizures per day. This is the case where we saw complete resolution at 32 weeks. It did take longer for this particular case. He's now been seizure-free for 3 years. So let's look at, why would chiropractic potentially, help all these people? What are the mechanisms? Let's take a look at the anatomy. So we're looking at the back of the skull up at the top here, and then we see the top bone. This is the atlas bone. It's named after that figure holding up the world, because that's what it does. It holds up your world. Your spinal cord travels through that very tiny opening. This is called the foramen magnum, a big word for big hole. And so your spinal cord and your blood supply, main blood supply to the brain, travels up through there. Your blood supply also travels up. It's actually housed inside your spine here to protect it, right? And then it comes up and it wraps around the atlas. It comes up through this hole here and then wraps her up and goes up that way. Do you think that if those bones were rotated, especially in 2 different directions, that might cause a problem for the brain? Absolutely. So here we see the main, this is just another depiction. The main blood supply to the brain is traveling up through your neck, right? So we don't think about our nervous systems very often until there's a problem. Here we have your brain. At the very top in that upper area is the brainstem. That's the area that processes the majority of sensory input in your body. This amazing system is covered by something called the meninges, which covers your spinal cord and brain. It's like a balloon-type fibrous tissue. It allows for cerebrospinal fluid to circulate around the spinal cord and the brain to nourish that tissue, bring nutrients, and take toxins out. Okay? And this amazing system, this nervous system that we don't really think about very often, is encased in bone. So why is it encased in bone? Yeah, it's pretty important, right? It's the most important system in the body, yet we rarely ever check it. As a society, how many of you have had a physical in the last year? Right? So what do they typically check? heart, blood pressure, cholesterol levels, urine, all these different things, lungs. Yet the nervous system somehow is neglected and forgotten, right? Until there's a problem, and then we look at MRIs. Then we were looking for pathology instead of looking for functional problems in the nervous system, which we can absolutely do. The testing is out there, and yet we are still neglecting this aspect of health. So a vertebral subluxation is a misalignment of the vertebrae. It happens most commonly in the upper neck. Why do you think it happens most commonly in the upper neck? What was that? Birth? Absolutely. Birth trauma is one of the most common forms or occurrences of vertebral subluxation. I don't have slides in this presentation on that. I speak on neurodevelopmental disorders and autism and other pediatric issues as well, but birth trauma is very, very common. I believe every single child should be checked at birth and throughout a lifetime for health and well-being. So birth is a common occurrence because there's so much stress and strain in a normal vaginal birth, but also even with cesarean section delivery and forceps, vacuum type deliveries, there's lots of force on that delicate spine. So the other reason is because it's shaped very differently than the rest of the spine. Our upper neck has to have a great degree of range of motion, and so it which is great for function, but it also means it can misalign more readily. Anyone see anyone doing this at all? All right. In fact, did you see this? This was a recent study that showed that I think it's like 20-something-year-old adults are developing what they said it was a horn in the news, but it's not a horn. Did you guys see that? Yeah, so what is it? It's an osteophyte, a formation of bone, because the bone responds to stress in the body. So now because of our lifestyles, we're developing additional bony structures, right? It's pretty wild. We need to do something about this. So this is why it happens most commonly in the upper neck, or it's caused by stress. Any of you have any stress? Right? I have a son who also has medical challenges, autoimmune situation, and so I understand the stress of having a child or being ill yourself. And so we're all in society under extreme stressors. Okay. So here's some of the known impacts of vertebral subluxation. We're going to go over the research. It affects your autonomic nervous system, that fight or flight versus resting, healing, digesting system, that vagus nerve system. It can affect the blood flow to the brain. It can cause an increased inflammatory response in the body. It alters the cerebrospinal fluid flow and creates tension in the spinal cord itself. How many of you play a chord instrument like a guitar or violin? Okay. Sir, if I was to take your guitar or instrument and start to tweak the strings at the head of the guitar, one, you'd probably be really upset with me, and two, would that affect the expression of that instrument? Of course. Absolutely, right? Our spinal cord attaches all the way down our spinal column. When there's deviations of our spinal column, our spine, it's going to affect the expression of the nerves and all the information traveling over and through it. So here's some research looking at blood flow in seizures. So I'm going to go through this rather quickly, but what they're finding is that there's alterations in blood flow during and before seizures, and depending upon the type of seizures. So convulsive seizures, they're seeing an increase in blood flow. In absent seizures, they're seeing a decrease in blood flow, not surprising. This particular study was looking at this middle cerebral artery. This is the artery that comes up from the vertebral artery that comes up through the neck. They found that the blood flow is significantly decreased during these spontaneous absent seizures. Now, the second section here says neurogenic control could also influence cerebral blood flow. So blood flow is being influenced by the nervous system because these blood vessels have a dense network of sympathetic and parasympathetic nerve fibers. So anyone experience migraines? All right, those aren't fun, right? So blood flow is being constricted, and many times it's being controlled. That's being caused by alterations in your nervous system response. If you're in more of a stress response, that's going to create more constriction of arteries. Does that make sense? And so what they're finding is that one, there's a decrease in alteration in blood flow, and that it's potentially being caused by nervous system response. This is another study also, just more information, more research showing that blood flow is being affected during seizures. And so this is where chiropractic comes in. This is in the book, The Craniocervical Syndrome and MRI. This is a book written by various specialists in the field, medical doctors, chiropractors, other specialists, looking specifically at this upper cervical region, this upper neck region. And what they did is they did functional MRI. So functional MRI is different than a static MRI. A static MRI is one moment in time. A functional MRI is actually looking at activity and blood flow, cerebrospinal fluid flow. I don't know if you can see this, but on the left, it's hard to see, but there's a decrease in there's spinal stenosis. There's decrease of the space for the spinal cord and the fluid on the left before an adjustment of the neck was given. And then on the right, we see a reduction of that stenosis with improved cerebrospinal fluid flow. So they're actually documenting this and seeing this in imaging studies. This is from the book Hydrocephalus, and these authors are speaking of the same thing. They're saying even a loss of your normal cervical spine curvature is enough to pull on your brainstem, pull that down, pull the brain down into the lower parts of the spine, and then misalignments then of this upper two bones in the neck can impair the normal cerebral spinal fluid flow as well as the blood flow. This is a big deal. This is a small study. This was a Doppler ultrasound study of 20 healthy subjects receiving one chiropractic adjustment, and they found that there was a significant change in that middle cerebral artery blood flow. It was temporary, but they are seeing that the blood flow does indeed change inside the brain after an adjustment of the neck. This was a big study done out of the University of Chicago. And you may have seen this years ago, they found that one adjustment of the neck decreased, on average, there was a decrease in the blood pressure by 14 points systolically and 18 points in diastolic blood pressure from one adjustment of the neck, which lasted for 8 weeks. Right? So I believe, okay, this is, now notice, I told you I'd let you know when it's my opinion and when it's research. That's the research. I believe, this is my opinion, that certain types of cases, there's more of a blood flow issue, and in other cases, there's more of a nervous system issue. Okay? You can't separate the two completely, but in cases like drop seizures, anyone have drop seizure issues? In drop seizures, I believe that those are more of what we call a rotary, a counter-rotation misalignment, with one bone going one way and the other bone going the other. Okay, C1 and C2, and creating lots of torque. That's what I've seen clinically in those cases. And those cases typically do the best or have a very good response rate from what I've seen. Now, other cases it's more neurogenic, more autonomic nervous system. So this is your autonomic nervous system. I think we should all be very familiar with it. Most of us are very familiar with it, but really familiar with one side of it. And that's the sympathetic side, which is also known as the fight or flight response. How many of you know what the fight or flight response is? Okay. How many of you are living in it right now? Right? We laugh, but honestly, the truth is, in our modern day lifestyles and with the amount of stress that you guys have, it's extremely likely that you're all in fight or flight or in low parasympathetic nervous system response, okay? Because what happens when we're in fight or flight response physiologically? Like, what do we start to experience in our bodies? Panic? What else? Adrenaline, right? Heart rate going up. Our body is preparing to run or fight. If there's a tiger in the room, you should run, right? And when that tiger is gone, though, what should happen? What should happen physiologically in our bodies? We should relax. Our heart rate should go down. The blood stops. Our heart stops pumping as much. So when we're in fight or flight, where is the blood? Are we creating more blood in that moment? No, we're not creating more blood. It's just being pumped somewhere. So where is it being pumped to? To your muscles, yes. Your big muscles so you can run or fight. And it's being redirected from parts of your brain to another part. So it's being moved from your prefrontal cortex, which is your thinking rational brain, and it's being sent to your cerebellum, your instinctual reptilian brain, so that you can act more instinctually and be in that more of that fight or flight response. It also takes then the blood away from your organs of digestion. So people in more fight or flight are going to have more issues with digestion. They have constipation issues, they're going to have gut issues, things like that. So we can't stay in fight or flight forever, because what's going to happen if we're in fight or flight forever? Heart attack, all sorts of things. Our body's going to break down, right? If we're not getting into the other side, which is healing, resting, digesting, repair, and socialization, right? We see all kinds of people with anxiety disorders, things like that, who see massive improvements. Many times people don't have anxiety, they just have a nervous system. But imagine a child now, a child that's born into fight or flight, early life stress, and they stay stuck in that state. Do you think that might affect the way they learn? ADHD, focus issues, things like that. Do you think that it might affect the way they socialize and interact with others, peers, family members? Absolutely. So my question is epilepsy a syndrome of dysautonomia? Okay, dys meaning dysfunction, autonomia, autonomic nervous system. So is this a state of dysautonomia, meaning that autonomic nervous system is imbalanced? So let's take a look at how we measure that. So heart rate variability is the gold standard in healthcare for measuring this. If you look up on PubMed or Google Scholar, you'll find like 33,000 articles on heart rate variability. This is the gold standard for measuring if you are in fight or flight or resting, healing, digesting physiology. Do you think that's an important test to assess? Absolutely. It should be part of our normal wellness checkups, and absolutely whenever there's a problem when it comes to our health. So heart rate variability is measuring the intervals between our heartbeats. Okay, so our heartbeat shouldn't be like a metronome where it's like doot, 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 doot. It should be constantly changing. It should be doot, 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 doot. It should be constantly changing to match the constantly changing needs of our internal environment and our external environment. That means that our nervous system needs to be able to tell your heart how to constantly be changing the heartbeat at all moments of the day. Does that make sense? So this is an indicator of your overall autonomic health. And so we can measure that. When there is a lower heart rate variability, meaning your heart does not have high variability, it's associated with chronic diseases, epilepsy, high-risk arrhythmias, sudden unexpected death in individuals with epilepsy. So to break it down and make it more simple, low HRV equals fight or flight. Okay? So if you have low HRV, you're more in a fight or flight state. If you have a higher HRV, that means you have more of that positive vagus nerve function. This is why they're doing vagus nerve stimulation, right? And now they're able to do it through transcranial stimulation, or transcutaneous through the ear. Have you guys seen that? I don't know if they have it here, but you can stimulate the vagus nerve through your ear because the vagus nerve has various points on the ear itself. So look at that as a potential option as well. So let's look at the literature then when it comes to epilepsy and heart rate variability. This is a review of the literature, so it's not just one study, it's multiple studies. They said we confirmed and extended the hypothesis of a sympathovagal imbalance in epilepsy. As lower vagal, so low vagus, and higher sympathetic or high fight or flight tone are predictors of morbidity and mortality in cardiovascular samples. Our findings highlight the importance of investigating autonomic function in patients with epilepsy in clinical practice. This should be part of the standard of care. I believe every single person who's having seizures should be getting heart rate variability testing done. This was another study. They found that there's often a sudden shift towards more sympathetic overdrive, so more fight or flight state during and before a seizure happens in that particular study. Sorry that it's cut off there. Another study, just more of the same, guys. They're finding that people having seizures have high sympathetic tone, high fight or flight tone, and low parasympathetics. They're not getting into the parasympathetic system as much, which is why we're doing things like vagus nerve stimulation. So that's your vagus nerve. I thought it'd be nice to introduce you to it. It's the longest nerve in the body. It's responsible for the overall tone and tension of your organs and regulating your autonomic nervous system. And it's not just epilepsy. If you look at the literature, and you'll see that across the board with pretty much every major health condition, you're going to see an imbalance in heart rate variability. And if we take a step back to the original premise I talked about in the beginning, it should make sense. This is why I don't label disease and I don't treat disease in my office. I believe that the body's designed to be healthy. I'm not saying that it's not helpful to have diagnoses. When my son developed a situation, it was helpful for us to understand it. However, if we're simply trying to treat the disease instead of restore function, then we're going to always be battling disease instead of restoring health. And so all these people in these different situations, from depression, anxiety, multiple sclerosis, rheumatoid arthritis, Alzheimer's disease, they all show the same thing. They all have a big imbalance in their autonomic nervous systems. Because if you're not in a healthy autonomic nervous system state, you're not getting into healing and repair. Your body's not doing what it's designed to do. Does that make sense? Fibromyalgia, chronic fatigue syndrome, Parkinson's. So this particular case, this young girl came to my office. She couldn't bend over. She was like this, just about as far as she could go. That was one of the reasons she came in, but she was also having seizures. Those seizures started within a few weeks after a trampoline injury, where she landed on her lower back and then couldn't bend over. Okay. Now, unfortunately, the doctor she was seeing told them that, oh no, it's not related to this injury. Yet they happened soon after. The spinal cord is attached all the way up to the top. Just because you have a lower injury doesn't mean it couldn't affect everything up above. And so within 3 weeks, she was seizure free. 4 months later, and now this is probably 3 years ago now. Completely different child. Yeah. This young lady, Ariana, she came to us. She had multiple neurodevelopmental challenges, and she was also having seizures. And so some of the things we saw a decrease in frequency of seizures, but most vividly is we just saw her start to wake up. Her expression, her socialization, everything was so much better. The only unfortunate thing is that because they live so far away, we didn't get to continue care with her and really see the full correction. But we saw massive changes within a short 3-month period. So when it comes to heart rate variability, and then just looking at people who are having improvement and resolution of their symptoms, this was a study looking at people. This is a small study. It's 5 people having generalized seizures, and what they found is that the control of these seizures was always accompanied by an increase in parasympathetic nervous system. So increased parasympathetics and decreased sympathetic, fight or flight. Have you guys heard this, that listening to Mozart can help decrease seizure frequency? How many of you do that? Or, yeah, cool. Does it work? Seem to? Yeah. Well, in this study they found that, and it should make sense that it's the same thing. It's calming, it's relaxing to the nervous system, right? So there's multiple strategies you can employ in your lives to help your nervous systems. Having calming scents in your home, like essential oils, lavenders, things like that. Anything that can help decrease the stress on your nervous system is going to be helpful. Because we know that stress is a trigger. How many of you have noticed that stress is a trigger for seizures? Okay? Let's think of it this way. What is the system in your body that regulates and manages stress for you? Your nervous system, right? So think of it as a bucket. We all have stress, right? We all have stress every day. That stress is pouring into your bucket. And a healthy nervous system should be like a big scoop, like scooping that water out so it doesn't overflow. Okay, and as long as it doesn't overflow, then it's not going to trigger a seizure. So a healthy nervous system will regulate that stress. It will transform that stress and dissipate that stress, as long as the stress isn't overwhelming too. Like stress can just become too extreme. So we know that stress is a trigger. Now, think of it this way, if we can, and I mentioned this already, especially with genetic situations, but this applies to everybody. If we can help the size of your bucket, your nervous system, be stronger and bigger, then you'll be able to handle more stress. And that goes for everybody in society, not just this group and population. So this is Brett. Brett was diagnosed with epilepsy at 20 months. He also is diagnosed with autism spectrum disorder at 2.5 years old. He was having up to 800 seizures a month, just massive amount. He was in massive fight or flight. He was hiding under the table when he came to see me. And you'll see it in kids too, especially because many children with autism especially, their heads are always on a swivel. They're always looking around their environment, right? It's because they're in massive fight or flight. They don't trust their environment. This is why transitions are so hard too, and new people, new experiences. Within just a short time, his seizures reduced by 95%. Now they were also using CBD, and so that was, I'm sure, a factor in this. However, Mom knows that the chiropractic was a massive increase. He was never looking at the camera. He was never smiling when he first came to us. In fact, that was before picture. Do you notice an issue with head position? Yeah, his head was stuck off to the side. But then you also see it in his knees going in, flat feet right there. I'll show a picture actually right here. So take a look at this. What do you see when I add these lines to this patient's image here? What do you see in terms of the alignment of the ears? You see an issue? You can't see the whole shoulder, but do you see that the shoulders aren't even? And the scapula, the winging of the shoulder blade there? Even the pelvis is rotated. What you're looking at is not postural problems, you're looking at a nervous system problem. Your nervous system tells your muscles where to put your bones. When there's stress in your nervous system, it will manifest in postural distortions. The other thing is, your body wants to do everything it possibly can to reduce tension on your upper neck. So instead of walking around like this, your body does this. Okay, one shoulder becomes higher, one hip becomes higher, and so we can measure that through the leg lengths. You can measure that. You can go home and check your families, check yourselves, have them lay flat on the bed, look at their leg lengths and see if they're even or not. They should be even. If they're not even, that means that there's tension in your nervous system. It's not that the leg is shorter. It's very rare that there's an actual short leg. So here's what the research shows when it comes to heart rate variability and adjusting the spine. And this was a review of the literature. This was a systematic review. They found that adjusting the upper neck has a parasympathetic, resting, healing, digesting vagus nervous system response. Okay. These are 3 more studies. One was in the Spine Journal, Journal of the American Osteopathic Association, Journal of Chiropractic Medicine. 3 different studies, all finding cervical adjustments of the neck result in parasympathetic, resting, healing, digesting responses, whereas adjusting the mid-back would result in more of a fight or flight response. And that's because of the different nerves and where they go throughout the body. The second study, upper neck adjustments, parasympathetic effect. And again, another one, adjusting the upper neck and also the lower back had that parasympathetic, resting, healing, digesting effect. Now in practice, my goal is never to stimulate or inhibit nerves. Okay, I'm not saying, okay, today I'm going to adjust your neck to stimulate that vagus nerve. See, that's where we get into problems in both my own profession when chiropractors try to do that, and also then say with like vagus nerve stimulators. Because then we're trying to use our educated mind to stimulate an infinitely intelligent system, way more intelligent than our educated brains. Does that make sense? For me to say that I need to stimulate your upper neck today is completely contradictory to anything I could ever do as a chiropractor. Instead, this is what we do. We look for objective indicators from your own body. There's neurological reflexes that we can access. We check leg lengths. We check nervous system reflexes. We see what your body wants and needs that day. We're accessing that intelligent information, that wisdom of your own body. Now, whereas a vagus nerve stimulator or something like that is just saying, okay, we need to stimulate this. We need to stimulate it. We need to stimulate it. We need to stimulate it. But what if the body doesn't need that in that moment? And that's where I will know whether or not someone even needs an adjustment. Many times people will come in and they don't need an adjustment. And that's the key difference, is trusting that amazing intelligence. This was a study with over 800 references. There's extensive, if not overwhelming, influence for a manual model of care that positively influences the autonomic nervous system. So this was looking at massage, was looking at acupuncture, was looking at chiropractic, osteopathy, all these different manual methods of care that positively affect the autonomic nervous system. As I mentioned before, we use paraspinal thermography. This was just a study showing that the different imbalances, it should be within 0.5 degrees. When there's differences in that, then we know that there's an interference. So here's some more cases. This is 24-year-old female, seizures, grand mal started at 18 years old. Keppra and folic acid reduced to 1 time per month. And then it transitioned to absence seizures. She became really spacey. She couldn't go to school anymore. She just really couldn't function, even though her seizures were more under control. When we look at her scan, we saw major imbalance, 4 degrees different at C1 at the top, the upper neck. At 1.5 degrees, that becomes a severe difference in temperature. So 4.4 degrees was huge. This was 6 months later. You see a difference? Right, it went from this to this. Let's see, I can't read the whole thing here. So her absence seizure, in 6 months, her absence seizures were gone. She no longer had headaches or migraines. What I didn't read to you on the previous slide was she had a chronic history of migraines and headaches. If I go back far enough in almost every patient's history, I'll find a history of growing symptomatology, building and building and building to a point to then it becomes seizures. Almost every case, even with children. So there's some really cool research that's been coming out the last few years. This was a positron emission tomography study. They looked at before and after scans of individuals who had received a chiropractic adjustment of their neck. What they found was that the brain was working much more efficiently after an adjustment of the neck. How many could use a more efficiently working brain? All right? I've been receiving chiropractic care for 27 years. Someone said how young I look earlier, and I'll take any compliment I can get. I attributed that and not getting, in the last 27 years I've been sick maybe 6 times in that, I'm talking about like a cold. It massively has impact on your immune system and many other features, and this is why the brain works better after an adjustment. Your body knows how to work better when it gets the proper information and can process that efficiently. This was another study. This was this is an EEG. This is an EEG study. They're looking at the brain and what parts of the brain are working more after an adjustment of the neck, and they're finding that the prefrontal cortex is the area of the brain that's working more after an adjustment of the neck. There isn't a ton of research specifically on chiropractic and epilepsy. Why do you think that is? Yeah. Chiropractic is a self-funded profession. We don't receive money from the government except for occasionally like a low back pain study, which in my opinion is not a good use of those funds. We don't receive money from pharmaceutical corporations or anyone else because we don't give pharmaceuticals. And so we're definitely in need of research dollars to look into this. This was just from an individual office. This was 17, actually this was a review of the literature. They found 17 different pediatric epilepsy cases receiving upper cervical care. Now there is a difference in chiropractic care. You have to see someone who's very specific, and I will give you some ways to find someone in just a bit. So they received upper cervical care, upper neck adjustments for 15 of them, and all of them reported positive outcomes as a result of the chiropractic care. So when I give talks like this, the last thing I want people to think is that chiropractic is a cure for epilepsy or seizures. Okay, that's not the intent of chiropractic, and it has to stay that way. Otherwise, honestly, the results won't come. Chiropractic is a way to improve nervous system health and function, and it should be there for every single human being, and especially for people that are having chronic health challenges and serious ones like epilepsy. This is a review of the literature. This is people like myself who've been receiving chiropractic care for no symptoms, just for regular wellness and maintenance. But here's the thing, they saw improvements in everything from hormone function to immune system, muscle strength, athletic ability. This is why all the Olympic athletes all are under chiropractic care. Reproductive hormones, neurocognitive function, all these things improve for people with no problems. So imagine what chiropractic could do for people that are having some serious nervous system issues. Right? Like Sandra. Sandra was 32 years old when she came to me. She was in her second trimester. She was having myoclonic seizures. They just came out of the blue, but they didn't because she had a chronic history of migraines. Right? Chronic history of migraines tells me that there's an upper neck, upper cervical issue. Her paraspinal thermography looked horrible. This was a surface EMG scan. This is looking at the electrical impulses traveling from the brain down to the muscles that support and stabilize the spine. So remember I said red was bad? Black is horrible. We rarely see black on these scans. So her body was working so inefficiently, using so much extra energy just to sit up straight. Right? This is afterwards. This was in this is a 6-month period. Looks a little different, right? This was her paraspinal thermography scan. This is, now, I have never even seen black again since this case. Okay, on a thermography scan. She was 12.6 degrees warmer on the right side of her body here versus the left. It was a massive difference. This was her follow-up scan. Notice, it's still red, but she was doing much, much better. And then we saw this shift. This is normal. We'll see more activity on the opposite side as her body's correcting itself. See, that's what we're talking about. We need the adjustments need to be very specific at the right place at the right time if the body needs it. And then the body does its own adjusting to correct the other imbalances. So she ended up, after her, I think it was a week of care, and her seizures were gone after a week. So this is a case, this was one of the genetic cases, 7-month-old child. Her first seizure started at 6 weeks old. She was having 8 to 15 seizures per day, pre-medication. Afterwards, it was down to 1 to 2. She was extremely lethargic. She couldn't really move her body well at all. She had no eye contact or socialization. And she had major imbalances in her thermography. Her quality of life skyrocketed within the first weeks of care. She didn't come in for several years, and then she just recently came back. Her seizures had been increasing. She got back under care, and immediately her seizures started to go down. Her socialization improved right away too. And so this is a child, in a genetic situation. This is a really intense case. This child is wheelchair bound, and she has extreme limitations of matter. However, her quality of life is dramatically improved, and it's going to be something that she's going to need ongoing just to support her system so it could be at its optimal. Atypical Rett syndrome. After 6 weeks of care, seizure frequency decreased from 1 to 2 per day to 1 every 2 to 3 weeks. She also became very much more focused and engaged with the family. And this is my buddy Elliot. He's actually here hanging out. He also goes by Superman. That was us in the office the other day. Elliot was having 10 to 20 seizures a day, and they had started about 4 weeks prior, which everyone thought kind of out of the blue, but when we dug deep enough in the history, he was having some tremors which started to intensify. There were some other issues. He had a lip and tongue tie surgery at birth. And so there was some issues with movement of his spine, spinal dynamics early on in his history, which did receive some care in the beginning, not in my office, but he did receive some care. But when we saw him, when he presented, he was showing some asymmetries of the face, the tongue going off to one side more so. And then when we had him go on the ground to crawl, he wasn't moving his left leg at all. He was just dragging it. Okay, there was major imbalances in both his movement patterns and his neurological patterns. And then after his first adjustment, he went down to 1 seizure that day. And then it was about every other day he'd have a seizure. And we'd notice those seizures would happen on the days we didn't see them. So we started seeing him every day. And doing that for about 2 weeks, we saw him become seizure-free 3 weeks into care, and he's now been seizure-free for, I think, 30 days or so. So that is one of my favorite superheroes right there. So here's how to find a provider. As I mentioned, the chiropractic profession is very specialized. Some offices, and maybe you've been to them, they specialize. They focus on car accidents and injuries and sports performance and things like that. You need to find a chiropractor who is specifically trained in detection and correction of vertebral subluxation. You also want to find someone who's using objective scanning and technology, using things like heart rate variability, surface EMG, thermography, and/or X-ray. Not every office has all four of those. I don't have X-ray in my office. I don't routinely X-ray people because 65% of my office is pediatrics, so we're not doing a lot of X-ray. But you do definitely want to see an office that has things like thermography. Thermography should be like a minimum. But I got to tell you that that's not always possible in your community. You might have to drive 30 minutes, an hour. We see people from Tijuana. I'm in San Diego. There's a family that drives 3 times a week for care for their child who has autism, and it's been well worth it. I mean, it takes 2 to 3 hours to get across the border at times, and this child's quality of life is massively improved. For pediatric cases, you want to make sure you find someone who has additional training and experience. An adult spine is not the same as a child's spine, and vice versa. IFCOchiro.org, chiropractic.org, and ICPA for kids.org. You can email me. I also I'll be at my booth for a while. I do have to go home and hang out with my family shortly. However, I have my computer and I have a contact form there. If you want me to find a referral for you in your zip code, just fill out that form. I'll help find somebody. A lot of people will come to our office for initial evaluations, and then we will share our findings with that office as well. With that, I can take a few questions. I think we have some time, so I'd like to open it up to questions. Yes? I've worked with numerous people that have had strokes and seen really good improvement. I think that in any individual who's had a stroke, they have major nervous system issues. We need to help clear any stress, as much stress as possible, optimize that system, allow that person to have the best chances for optimal quality of life. I'm sorry? What booth? I think 211. I'm in the 200 area. Yep. Yes.
Have you ever had a flare-up in a seizure? We used to go to someone that has these technologies. I know each case is different, but he sometimes would flare up with a bigger seizure, and I don't know if it was too much flow or if you had experience.
So. The chiropractic profession has been helping people with seizures for a very long time, although the profession has moved away from helping these really intense cases more, in the last 30 years as insurance reimbursement started only reimbursing for musculoskeletal issues and things like that. But my experience has been listening to a lot of old timers, people that have been doing it for a long time ago, and they'd say, hey, just so and share with the people you take care of, you could see an increase in seizures temporarily in the beginning. Personally, I have not seen that like long term. There's one child who has Tay-Sachs disease, who we will see in the beginning. His nervous system was so delicate, you could barely even set him down on the table without him going into a seizure, any touch at all. And so the key was, you have to meet that person's neurological needs and through the force you apply. And so sometimes it's literally just a light touch and light tapping instead of a big, more osseous adjustment. So it just depends on the case. Every case is different, and that's where the art form comes in. I'm not saying that the chiropractor did anything wrong. It just could be that we may see that initially. The child I mentioned who was coming to us from Tijuana with autism, he had extreme constipation. He would take him 6 days to have a bowel movement. Tantruming 90% of the day. After his first adjustments, he would go home and have extreme diarrhea and vomit. his body was processing toxins. It was clearing it. Within that week, his bowels became regular. He was no longer constipated, and his skin tone improved, his demeanor, his socialization, affection. So it wasn't a negative effect. It was his body doing more of what it needed to do. Yes?
Along that line, I know for a son who has autism and epilepsy, each outputs a big factor. And you were talking about something around there was some matter around the spinal cord that helped. Can you talk to me specifically?
Oh, so the question is, what is the I guess the mechanism that helps with detox in the body, the brain and spinal cord? So that's the meninges and the cerebrospinal fluid. So the spinal cord and brain are encased in the fibrous tissue, and the cerebrospinal fluid circulates around that. Now here's something I didn't mention. What is the function of the heart? What does it do? It pumps what? So what pumps the cerebrospinal fluid? Not the heart. The spine. Your upper cervical region and your sacrum, your tailbone. Movement of those two regions is what pumps the cerebrospinal fluid. What do you think would happen if you don't have proper motion or movement and it's torqued? It's not going to pump. It's not going to move. It's not going to process. Not as well. I mean, your body's still going to do its best. But it's not going to be. It's like never having your oil changed on your vehicle, right? It's just going to become more stagnant. It's not going to flow as well. Yes.
What are your thoughts on kids who are hypermobile or hypercomplexive? We try to take our son to a chiro and they'll look at his neck. Now he's had multiple neck injuries and concussions due to his epilepsy. And so they'll look at his neck and go, oh no, we're not going to do this. Thought on that or care?
Yeah. So as I mentioned, there's specialists within fields, and it takes a lot of experience with those types of cases to know what to do. And in the case that's hypermobile, then it's not about manipulating or moving the bone. Okay, it's not about a big what we call an osseous adjustment. Those horrible videos on YouTube. That is the opposite of what actually good chiropractic is, honestly. My profession got very splintered early on, and we have this two different types of products. What you see on YouTube, I cringe when I see those videos. Yeah, some people like it for some reason. It's very gentle. It's an art form of releasing nervous system stress and tension, and so in those you need someone who's really. There's a technique called a tonal method, a tonal model. So a tonal model is looking to gently release tension in that system. It's not about moving a bone. It's actually never really about moving a bone. It's about releasing nervous system tension. So that's what we just need to find you someone who's really confident in that. Okay. Yes. Yes.
Heart rate variability. What if it's drug-induced? Does that affect that the same way, or is it like better sleep naturally, but he's on so much medicine, he's drug-induced?
Yeah. So this will be the last question because I need to make sure I make time for the next speaker. So. If the heart variability is being affected by the medication, we can still help the nervous system response. The medications are going to always be there affecting it. However, we can still optimize the response of the body and see improvements that way. So I'll be around outside. If anyone has any questions, I'm going to be at my booth. So please come up and say hi, and I'll be there answering any questions. Thank you so much, guys. How long will I be there? I'll be there I'll be at my booth probably for 30 minutes. Yeah. But send me an email or message as well. I'd be happy to communicate. Okay. I do. In Prescott and in Scottsdale, and so yeah, you can find you somebody. Yeah. Just send me a message with your zip code. You can find me on Facebook too. That's a good way. And we'll find you somebody.